This longtime fitness instructor teaches spin to serious athletes. But for most of her adult life, Tina has had crippling pain in her left ankle.
Because there's no cartilage in the ankle joint, basically I was bone on bone.
She's worn braces and boots, done therapy, and visited countless orthopedic doctors.
I'll be honest, I seriously asked a couple doctors and contemplated amputation.
Lou Schoen is not only an accomplished keyboard player, but an orthopedic specialist using skilled hands to perform delicate foot and ankle surgeries.
The ankle joint loses its cartilage, and you can see here some cysts.
When medication and injections fail to relieve pain, patients can either fuse the ankle joint or replace it. For patients with a history of infection or bone disease, fusing or welding together the two bones that make the joint might be the best option.
Get rid of that joint, stop the motion, stop the pain.
But fusing prevents the back and forth flexing motion, so Tina resisted. 5 years ago, Dr. Schoen replaced the joint.
The ankle replacement allows us to remove the diseased cartilage and bone, realign the ankle, and replace the surfaces with metal and plastic.
With the replacement, Tina can do everything she wants to do except run. She and her pup choose to walk instead. I'm Marty Salt reporting.